Hi everyone, welcome to researchmd.com. We got another great presentation. We're going to look at a different article today about health benefits of apple, and we're just going to see the analysis of that article. Again, my name is Pramil Cheriyath. I work as a director of research. I'm a program director, internal medicine residency program and a transitional residency program, and also assistant professor of medicine at Arkansas School of Medicine. So we are going to look at the benefits of eating apple, and by health benefits to tell you, okay? So let's get into our subject. So if you look at apple, got like in a lot of nutritional facts, like what do they say? Eat an apple a day, keep the doctor away, right? So if you look at apple, you got like one serving, it equals to 95 kilocalories. You got vitamin C, you got vitamin C like 8.4 milligram, right? And vitamin B6, you got vitamin B2, and vitamin B1, K, vitamin E, everything in there. And minerals, you got copper majority in there, like potassium is in there, manganese, phosphorus, magnesium, carbohydrate, 25 milligram, water is 155.7 milligram. Protein also 47 grams, and so you got dietary fiber also 4.4 grams. You got everything pretty much kind of built into an apple. Okay, right. Now, what is this study? This study is about association between apple consumption and the doctor visit. The study is also kind of looking pretty much, our saying is eating one apple a day, keep the doctors away. So this study was published in JAMA a few years ago. We're just going to look at it and see what are the results into simple terms so we can analyze it. So objective of the study is to investigate the association between apple consumption and physician visit. Does the saying apple a day keep the doctor away actually work? Okay, so in the population, for this study, what they used is there's this huge national health and nutritional examination survey. It's one of the biggest survey. It's done every year. They go into people's houses. There are like 20,000 people all across the United States. They collect their blood. They send like 10,000 questions to them, like a survey, and they have to fill out the survey. Okay. If you plan into any information for a nutritional study, this is the best study out there. So they went into this nutritional survey, and they took all the adults, like 18-year-old, and the survey from 2007 to 2010, right? And they looked at the people results based on if they eat apple and they did not eat apple. So if we look at our population, they got 753 patients who ate like one apple per daily, and actually 753 people. I don't want to say patient, we don't know. And then no apple, we are 7646. Okay, so in the apple eating one, at least people eat one apple a daily. That's like 753 people. Who does not eat apple, there's 7,646 people in the study. So what did they find out in the result? They found out the people eating apple once a daily versus the people who does not eat, there was not much significant. They did not find any significant. That means they did not find any relationship. Now, what did they find? They looked at, and the people who eat apple a daily, they have less prescriptions compared to the other people, okay? The people who does not eat, they're taking like a lot of prescription medication. That means they're not very healthy. There is also, when you look at the study, I think we'll come back to the results when we can talk about what are the strength of the study. When you look at the strength of the study, this is again nutritional survey. The best and the biggest survey in the United States is the National Health and Nutritional Examination Survey. Large number of patients, good statistical method they used. Okay, what are the weakness of the study? Again, it's a cross-sectional study. It's very hard to look at the cause and effect, right? It's a survey, people kind of tell their opinion, not equal samples. That means you got 700 people in this, the people who eat. When you look at the other who does not eat, 7,000, there is like an unequal balance, right? When you have a statistical study with an unequal balance, it's always you can do something called a propensity index or propensity score to make the both sample size equal, right? That's probably better in the study, right? And I think the other thing, the weakness of the study, when they looked at the physician visit, some of the people, like most of the people, at least they get like once they go to the physician's office for a physical checkup. They should have put them into the healthy category. Okay, they did not do that. They even took and calculated out. So we'll come back to that. That's probably the results is kind of a little bit off. So what is the conclusion of this study? People who eat apple daily does not have decreased doctor's visit compared to non-apple eaters, right? That is, I wanted to say, that is, there's no statistically significant result. But in clinically, this is significant, right? If you look at it, 39% of the apple eaters avoided physician encounters, okay? While only 33% of the non-apple eaters avoided physical encounter. So clinically, there is still a benefit if you look at it. But when you look at statistically, it's not significant. What is the other finding? The apple eaters use less prescription medication versus non-apple eaters. So we need to, when you look at it, like, you know, if I'm taking a lot more prescription, that means I may be unhealthy, I got a lot more diseases. That also tell us, like, you know, apple eaters are healthier than the other people. So always remember, like, I mean, even though this is not a statistically significant, there is a clinically significant effect is seen. 39% of the people avoided physician visit, and while compared to only 33% in the apple eaters. Because I think when they did the study, they should have looked at the people who have only one visit. They should have counted them some healthy people. They did not do this in this study. Maybe so that is the reason I think they did not see a statistically significant result. So that is our conclusion about the study. Thank you so much for watching. We'll be back with another analysis soon. Please subscribe to our channel.